The White House is encouraging Americans to get some fresh air this Memorial Day weekend, but do it safely. Here's Dr. Deborah Birx's advice.
You can go out, you can be outside, you can play golf, you can play tennis with marked balls, you can go to the beaches if you stay 6 feet apart.
Dr. Mario Ramirez joins me now. He is an emergency physician treating COVID-19 patients in Nashville. He also served as the Pandemic and Emerging Threats Coordinator at the Department of Health and Human Services under the Obama administration. Dr. Ramirez, are you comfortable with the messaging that it is okay to be outside this weekend as long as you practice social distancing, wear a mask, things like that?
Hi, Allison. I think it's important to put things in context, right? What people need to realize is that our entire country is going through a period of re-equilibrium right now. We have just gone from having everything closed to all of a sudden things are starting to reopen back up again. But in 23 states, we know that case counts are actually going up. And so what I would caution people to do is to make sure and assess the risk in your local environment. If you're in one of those states where the case counts are going up, I'd be very cautious about going out. I do think Dr. Birx is right. It's a good idea to be outside, but absolutely important to make sure that you are avoiding large groups, making sure that you're wearing a mask, and making sure that you're keeping aware of your surroundings.
The president is telling governors to reopen houses of worship. The CDC has posted some loose guidelines. Here's what Dr. Birx is saying.
There is a way to social distance like you are here in places of worship. And I think what we're trying to say with the CDC guidance is there's a way for us to work together to have social distancing and safety for people so that we decrease the amount of exposure that anyone would have to an asymptomatic. And I say it that way because I know all of you and all of Americans, if they didn't feel well, they wouldn't go to church that day.
What sort of precautions would you want to see at places of worship before people are allowed inside?
Well, Allison, I think it's important, of course, to realize that the right to worship is a fundamental right in this country. And so I certainly understand why people want to get back to church. But I think to put it in context, we know that there are several cases where churches have proven to be sources for worsening infection. We've seen this in South Korea. We recently saw this in Arkansas, where more than 50 out of 90 attendees were infected. We saw it in Houston. And so what I would tell people is that, you know, you need to be very cautious and very aware if you do choose to attend church services in person. And if you do, I would make sure that the church is using the CDC guidelines, which recommend the use of face coverings, which recommend the use of open windows. And I would also recommend that if you can, that you should avoid large church gatherings. We know that smaller church gatherings are safer. But I think it's important to realize that going to church at this point in time in areas where there's a moderate or even substantial amount of threat is a very risky activity.
A major study out today from The Lancet found an increased risk of death for coronavirus patients taking hydroxychloroquine. Now, that is the anti-malaria drug President Trump has been taking preventatively. Could you tell us about what that study found?
Sure, Allison. So that was a study that looked at 96,000 patient charts and compared three groups of people. One group were people who were taking hydroxychloroquine, a second group taking hydroxychloroquine plus azithromycin, an antibiotic, and then folks who weren't on either of those medicines. And they excluded any patients who were taking remdesivir or were in the ICU or on ventilators. And what they found is that the two patient groups, those who were taking hydroxychloroquine or taking hydroxychloroquine together with azithromycin, were 34 and 44% more likely to die than those patients who were not taking those medicines. Now, you compare that to the original study that prompted a lot of the interest in hydroxychloroquine, which involved 54 patients. So 54 patients compared to 96,000. And I think that the strength of this study clearly shows that there's a danger associated with taking this medicine. And my hope is that the FDA will revoke the emergency use authorization for anything other than a clinical trial around this medicine. It's really not safe for regular people to be taking in any context.
Dr. Ramirez, young adults are starting to come down with that rare inflammatory illness that's been impacting kids. Does it manifest itself differently depending on age? And are there particular things parents should be looking out for here?
Yeah, so Allison, I think we have a tendency to sort of split patients into two groups, and we say they're either kids or they're adults. But the truth is that physiology is really kind of a continuum, and there's no sort of absolute point where someone stops being, a child and becomes an adult. And so what we see, right, are statistical changes in how disease manifests itself across these populations. It does appear that this sort of inflammatory syndrome is more common in younger persons. And the symptoms seem to include a rash, a swollen tongue, persistent abdominal pain, some diarrhea, and then unfortunately also some inflammation of the heart. And those are the symptoms that parents really need to be on the lookout for. If their children continue to complain of those symptoms in the absence of any other clear cause, it's certainly something that they need to speak to a doctor about. But I think also it's worth noting that at this point, we really don't have a good idea for what the risk factors are. And that's what's making it so hard to diagnose in some folks. We don't know if it has a certain predisposition for men versus women, for folks of certain ethnicities. We're still very much the point of disease where we're trying to figure out, who's at risk for developing the syndrome.
Yeah, there's still so much to learn. Dr. Ramirez, President Trump has already been criticized for responding too slowly to this pandemic. Here's what he said about dealing with a potential second wave.
People say that's a very distinct possibility. It's standard, and we're going to put out the fires. We're not going to close the country. We're going to put out the fires. There could be, whether it's an ember or a flame, we're going to put it out. But we're not closing our country.
Doctor, you served in the Office of Pandemic and Emerging Threats under the Obama administration. What do you think of the president's comments there? Concerns about that approach?
Yes, Allison, I am concerned. I think that the issue around mitigation and social distancing has gotten a little bit muddled with the second wave. And here's what people need to know. Since 1700, there have been about 8 pandemics that we have traced historically. Of those 8, 7 have had follow-on waves. And that's really a function of the virus actually circulating around the world and recirculating in the southern hemisphere before it comes back up. The measures that we take around social distancing, around breaking transmission chains, those are designed to sort of decrease the reproductive number or the number of people who are affected. But whether or not the virus actually comes back is a function of the environment and the virus itself. Our ability to keep those second wave peaks from going up is a function of our ability to quickly determine who's infected, isolate those persons, and isolate their contacts.
Great advice, great expertise always. Dr. Ramirez, thank you for being with us, and I hope you have a great holiday weekend.
Likewise, Allison. Thank you.
Most people call 911 in an emergency, but not in Mexico City, where NBC chief foreign correspondent Richard Engel reports some people are hiring private ambulances during this pandemic.
Allison, Latin America is getting hit hard right now by COVID-19, and we've seen this disease move from country to country, from region to region. It started out in China, in Asia, then it jumped to Europe, after Europe, the United States, and now it seems to have settled in this part of the world. And here in Mexico, we know that there are many, many infections, but we don't know that from the official statistics because this country openly says that it is not doing very much testing. I spoke to the top czar, the COVID czar here, their equivalent of Dr. Fauci, and he said that it's a fallacy to try to count all the people here, so they're not even really bothering. They're just testing in very specific situations. But the reason we know there are many cases is we've been following ambulances. And we spent 2 days following one particular ambulance company. It's a private ambulance company. And I asked the owner of the company, who's also a paramedic, he's been a paramedic for 28 years, why more and more people are using his services instead of just the normal state ambulance services. Why are people using your service instead of just calling 911 and calling a government ambulance, a state ambulance?
In part because the government services are overwhelmed and they can no longer respond to the amount of calls they have. In another reason is that they trust more someone that they are hiring for a service, and that's the case of a private ambulance. So if you call us, we will be there. If they call 911, well, no one precisely knows if they're actually going to get the help they need.
Another indication of the scale of the problem here. Many of the hospitals are completely full. In fact, the ambulances have to go from hospital to hospital because oftentimes they're turned away. The hospitals simply won't receive the patients, and the hospitals that are willing to take COVID-19 patients or any patients at all tend to be the ones that have the poorest conditions, the least amount of equipment, and some of the doctors and nurses in those facilities have been staging protests. They've been secretly filming videos showing appalling conditions with bodies stacked up in storage rooms, and the crematoriums in this city are working around the clock. Allison?
Brazil is now on track to become the world's #2 coronavirus hotspot behind the U.S. NBC chief global correspondent Bill Neely is in Sao Paulo.
Yes, hi, Alison, from Sao Paulo, Brazil's biggest city, which accounts for about a quarter of all the deaths and infections in this country. And we've had record figures in the last 24 hours. More than 3,000 people have died of coronavirus in the last 3 days. 60,000 new cases. The death toll here doubling every 11 days. Now, remember, in the United States, the death toll so far has doubled roughly every 3 months. So it's really a very serious situation. I spoke to an intensive care specialist this morning who said the real problem is that in this city, 10 million people are observing the lockdown and 10 million people are out on the streets. That's 10 million potentially infecting others. And of course, the other problem in this city is there are millions of people who live in slum conditions, closely packed together, where the idea of social distancing is just a nonsense. A third problem is the divide between the President Bolsonaro, and the state governors. Although in a video conference, they did get together and the president announced $10 billion in aid for the various regions. And he called for unity, but at the same time, he called for the lockdown measures to end. Now, that's exactly what the governors do not want. They want people to stay in their homes. Earlier today, I was in a hospital where COVID-19 patients are being treated, but the hospital is full. It's been full for weeks. Brazil is desperately trying to build more field hospitals, but for example, in Rio de Janeiro, they promised 7 field hospitals. Only 1 has been built. And here, as in Rio, football stadiums have been converted into field hospitals, but they're simply being swamped by the huge numbers of new cases and new infections. So Brazil is on track to be the second worst country in the world behind the United States. And the coronavirus is spreading more quickly here. As we've said in the last few days, Alison, more quickly here than anywhere on Earth.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.